Yeah.
some headaches. Okay, so here we go. Always adjust everybody full spine. Rachel's a great patient. She keeps up with it. She does maintenance. Not just, you gotta take care of your body, you gotta take care of yourself. You can't just wait till things are completely falling apart. So that's not true of just chiropractic, but good decisions with your diet, drinking lots of water, getting enough sleep. Take care of your body, take care of yourself. Getting adjusted goes right along with that. Obviously, most of our patients come in for pain relief, and we're really good at that. We specialize in that, but if you can keep up with it and do a monthly visit or so, it goes a long way. So here we go. Take a deep breath, Rachel. Exhale all the way out. Good. And you are a little tough to adjust. All right, just a little muscle work in her shoulders, because that's where her chief complaint is. So just getting into the trap muscle, into the rhomboid muscles, and just breaking up the adhesions and the swelling and the scar tissue that life, the stress of just wear and tear of everyday, activities can cause. Let your arms relax out to the side a little bit. Perfect. So for the video purposes, we're just going to get right to the adjustment, but when we're done, I'll actually do a little more soft tissue. Try to do, 8 to 10 minutes of therapy on each patient. Go on your back for me, along with the adjustments. Just relax your shoulders, nice and light. Perfect. And this one, nice and easy. Just relax your shoulders, let your head drop. Perfect. Come on back on my hand. Nice. The last one. Good. On your side, facing me. Deep breath. Exhale, Rachel. Way out. Perfect. Other side. Arm up. Deep breath. Exhale. Let the air out. Good. Perfect. Perfect. All right. She's good to go.